Singapore has started reviewing its response to COVID-19 in order to prepare for the next pandemic. The government says details will be released when the review is complete. Gwyneth Teo tells us more.
Learning from the first phase of the pandemic response, when containing the spread of the virus was the priority at the time, Finance Minister Lawrence Wong says that for now, the after-action review will cover that period leading up to August last year. The AAR will be led by former Head of Civil Service Peter Ho, who has given all information on the government's response. When asked if the review will include an accounting of the 100 billion Singapore dollars spent on the nation's response, Mr. Wong says his ministry will do that as a matter of course, but it will not be part of this overall review.
There are many things that the AAR will cover, but the focus will really be on strategic issues of strategic and national importance, which will enable us to learn and do better, be better prepared for the next pandemic. I'm sure everyone will agree that it is in our shared interest to achieve that objective.
One area for review is the Disease Outbreak Response System Condition Framework. It was designed to make it easier for public agencies to coordinate their measures. Singapore raised its DORSCON level to orange, the second highest level in February 2020. It was stepped down to yellow in April this year.
In the initial phase of the pandemic, the MTF decided that for transparency, we would announce the DORSCON level and colour code publicly too. This would help alert the public of the need for personal vigilance and social responsibility. However, it had also led to certain public reactions, such as a rush to the supermarkets. And this is one key issue for review, as DORSCON is meant to bolster preparedness, not to induce public anxiety.
Mr. Ong adds that over the last 2 years, the public paid less attention to the DORSCON level. Instead, they became sophisticated in understanding public health measures. This includes vaccination, mask wearing, and safe management measures. The DORSCON framework was established following a similar review after the 2003 SARS crisis. One infectious diseases expert who was at the front lines of both SARS and COVID-19 says the review should also balance whether the measures were worth the social and economic costs to the country. He stressed that honesty and a no-blame approach would be crucial for this review to be effective. He's not part of the current review.
Perhaps the vaccine hesitators, how could we help those people more in the future? Nursing home patients, people living in crowded environments. Like every country, we found vulnerable settings, and this will be, part of the review to see how we can make those vulnerable settings safer going forward.
Another element of assessing the country's response is excess deaths. That's how many more people died in a year when compared to a historical baseline across recent years. This would include deaths due to the novel coronavirus, but also from patients putting off treatment for chronic diseases. The Health Ministry will release a special report on this soon, but has shared some numbers from last year.
Excess death in 2021 among Singapore residents is about 1,535. That's for 2021, when we had a Delta wave, after accounting for aging. COVID deaths as at end 2021 among residents is 804, or about 52% of excess deaths. I should emphasize that whether it is official COVID-19 death toll or excess deaths, Singapore will have one of the lowest rates in the world amongst countries that have chosen to live with COVID-19 and resume normal lives. And that is because of the cooperation of everyone in Singapore and the effectiveness of protecting our healthcare system.
Mr. Ong added that globally, the number of excess deaths is 2.5 times the reported death toll from COVID-19.